Okay, we're live. Good morning, everyone. Thank you so much for tuning in for another episode. We are going to have a lot of fun today. We have my friend Karen Hall here, and we're going to talk about PCOS, hormones, and all the things related. So, Karen, thank you so much for joining us. I'm going to have you introduce yourself. Tell us a little bit about what you do for fun, what you do for work, and what decade of life you're in.
Okay. Hi, good morning, everybody. Karen Hall. Who am I? What do I do for fun? And what decade am I? So I am in my 50s, proudly actually in my 50s. I'm going to say
Good.
that a little bit louder. And the reason that I think that's relative is because it aligns with the work that I'm doing right now. What do I do for fun? We'll come back to that. What do I do for fun? I'm a perpetual learner. So reading, always trying to stay current. Podcasts are fun for me. Getting outside. If anybody sees me on social, I have a dog. He is my ride or die, and that's my partner in crime. So he's my fun. So exercise, learning, dogs, cooking. That's probably my fun.
Awesome. What's your dog's name?
Claws, as in like
Oh,
Santa.
that's very cute.
So yeah.
Okay, and tell us what you do for work.
What do I do for work? I am a 20 plus year veteran nurse practitioner in the predominantly acute care arena. So, working mostly hospital, ICU, emergency room, hospitalist medicine. I've done urgent care. I've done a plethora. I'm very well rounded, I think. I've done everything from hospice and palliative care to medical spas and yeah, I feel like I've pretty much done it all. But I've currently entered a new season of life that so aligned with my past. I am now a CEO, founder, and practitioner for functional medicine. I own Power One Health right here in Saratoga. It's actually a hybrid virtual and in person practice. I have a couple of different streams where I focus on, as someone who's been in healthcare for 20 plus years, uh, I recognize that we as people in this service industry don't actually take care of ourselves. So I have started a direct primary care or bespoke primary care practice for people in the healthcare space. So if you need someone who understands your struggles and is out there feeling all the things you're feeling, but you don't have the time, you don't have the means, you don't have the energy, or you can't get in with your primary because we have the same struggles as everybody else, that it's a 3 week to 3 month wait to be seen, then I'm just a resource for you to reach out to. But my primary line is functional medicine, and that's open to the masses or the motivated, as I like to say, because it's a service that requires a participation and a partnership. It's not a here's your pill, here's your 15 minute.
Mhm.
It's not insurance based. So, but it's very deep dive into holistic healthcare.
Yeah, yeah. Tell us a little bit more for folks who aren't super familiar, and it's always good to hear from the practitioner directly. Tell us a little bit more about the difference between conventional and functional when we're talking
Sh-
about medicine or care.
Sure. What is functional medicine? Uh, it's more root cause, it's deep dive. So, the way I like to describe it is traditional medicine is taught here's your system. Here's the diseases that affect that system. Here's the treatment plan that goes along with those diseases. So it's very much treatment focused for disease.
Mhm.
Functional medicine is much more, I guess what I would say, swimming upstream a little bit and saying, how do we avoid the disease? How do we prevent disease? It's much more root cause. And if you do have disease, then let's figure out why you have the disease and what we can do as a collaboration or partnership to get ahead of that and either reverse it, change it, or at least minimize its impact on your lifestyle and living. So the way I tell people is you go to your doctor, they tell you you have high blood pressure. Here's your pill for your high blood pressure. You see a functional medicine practitioner, and we say, you have high blood pressure. Let's figure out why you have it and see what we can change to correct it without a prescription. Um, so it's not that we're anti medicine, it's just deeper medicine. It's more root cause medicine. It's more focused on prevention and correction and not just maintenance, which I kind of think is traditional medicine.
Yeah, you're not just slapping a Band-Aid on something. I also can't help but align it with much more compassionate, human-centric care
Mhm.
because, I mean, I talk with I've heard so many stories, and I've experienced my own doctor's appointments this way in conventional settings. Someone yesterday told me her OBGYN sets a timer. She physically watches her set the timer and then scoot over to the table.
Yeah.
I
It's
I've never heard that one. We all know they're working on a timer and, this isn't to bash doctors. I've said this before, very critical of our healthcare system. I'm very critical of our medical system, but this isn't about an individual doctor doing anything wrong. It's the system we exist in and that
Mhm.
they exist in. But I just, it's so and then they're just slapping it on like we're not treating you like they're not treating you like a person. They're treating you like a check mark at
Yeah.
best, a dollar sign at worst.
1,000%, and I agree, and I'm happy to hear you say that. There has to be a recognition that it's not individual, it's system-wide, right?
Yes.
Um, I think the thing I love about what I'm doing now, and to be fully transparent, I still work in the hospital. I mean, I still punch a clock and have a deadline of all these things have to get done within this window of time. So I understand the pressures of the current system all too well. I've been doing it for so long.
Yeah.
But what I love about this is there's no time clock. Our typical meetings with my clients are anywhere from, an initial intake can be 90 minutes long. We're going to deep dive about when your mother was pregnant with you, what happened? Did you bump your head as a kid? How many vaccines did you have? How many antibiotics have you taken in your lifetime? What food did you grow up on? What region are you from? It's really getting into the weeds about all the things that impact our health because
Mhm.
we are just one part of a bigger system. Our body is made up of systems, but we're one part of a system. So if you
Yeah.
see us all as that interconnected component, I think it's easier to make those connections for dots. But the other thing that I love is, I mean, people say, well, why don't you take insurance? And the reason we don't take insurance is because it's the insurance company that's telling your clinician, you've got 15 minutes in order to recoup your revenue costs, and we've got to keep moving. I just got tired of being told by people who are not in the healthcare arena how to practice medicine or how to practice health and wellness, and we remove the connection from it, whereas I think you see a lot of functional medicine, integrative medicine, holistic medicine, lifestyle medicine, all these terms are coming out now. They're all the same thing for the most part. We're all stepping back and saying, "Oh my god, you're a human being with a whole system of things that we have to address because they all impact your overall health and wellness." And again, it's not that this our current health system is very disease driven. It's not
Mhm.
focused on prevention.
Mhm.
And it's fabulous when you have an acute problem. I don't want to take that away. Do an amazing
Agree.
job of saving lives when we're
Yes.
deep in it. But we don't do a great job on the prevention, and we have lost a lot of that connection when there was a local town doc who knew everybody and they knew your whole family or they knew where you lived. They went to your house. That's what I get to do now. I get to either meet you here on a Zoom and see you in your own environment, or better yet, I have clients I come to their house. I have sat down in somebody's kitchen and done a full intake while we sipped
Mhm.
on coffee, and I got to see how do they heat their house? What's the environment? Like, really connect all the dots that
Yeah.
the current healthcare system doesn't afford us anymore, and that's why I pivoted and love functional medicine.
Yeah. Amazing. Amazing. Yeah, and it also sounds like the other thing that's getting talked a lot about now is epigenetics, like how everything is getting either turned on, turned off, whatever. That's not a very sophisticated way of saying it, but and functional medicine maybe is not synonymous, but a piece of that is definitely epigenetics. I mean, the things that you described from someone's childhood are all epigenetic
Yeah,
things that we're either turning on or turning off, and it's so fascinating. I think it can be overwhelming for people too because they're like, I couldn't have controlled how many antibiotics I got as a baby, and,
correct.
gut microbiome is so big, and then people feel anxious, like, I know I sometimes will feel anxious about the environmental factors or things that were present in my childhood, and, when I was growing up, when I was a toddler 30 years ago, no one was questioning antibiotics,
Mm-mm.
so it's like, so what can we So I guess speak to that, just maybe even like 1 or 2 sentences for folks similar to me where like I don't even either I don't know how many antibiotics I got, I don't know how long I was breastfed, I don't know how my mom's pregnancy went, like, those types of things. Like I always want to know. I just listened to something about microbiome, but what can I do about it? And I say this to
Mhm.
people all the time when this comes up. Like, more information is power. But
Yes.
unless we're going to do something with it, and unless we're going to alchemize big, scary information into something we can do about it or forward momentum, I almost don't always want to know everything. So,
Yeah.
so speak to that a little bit.
Sure. So you're absolutely right. And not all of us know our history really well or know, what we were up against as kids. But and that's okay. The one thing that I do like to remind people is your current circumstance, it's not about it's something that you did. It's not your fault. If you're struggling with health conditions or you're unhappy in the way you're feeling, it is not something you're doing per se. When we look at, talking about where did you grow up? Maybe you don't know how many vaccines you had or how many antibiotics you had or how long you were breastfed or if you were breastfed. Maybe you don't know that information, but you do know that, hey, you know what? I grew up in rural upstate New York next to farming. And so that helps us connect with, okay, there may have been chemicals used, exposure issues. Maybe I lived in an old house that was mold ridden and nobody knew it. But if we would do some mycotoxin testing and look for mold in your system and we find it, we can now go back and address that and
Mhm.
help you moving forward. So it's the first thing I think you have to make sure you point out with people is that it's not a blame game. It's not a if you don't know, well then it's your fault. It's not, you know, it's a matter of when we know better, we do better. So when we know where we start from, we can do better to figure out. It's like I jokingly talk about being an investigator because it's like
Yeah.
literally we're doing an investigation and
Mhm.
you're going to help me uncover some things that contribute to why you feel the way you feel or what struggles you're having. But oftentimes it's the patients who have these aha moments of, I never thought of that had an impact. Even when I did my own, honestly, Emily, I did my own questionnaire, my own evaluation. And one of the questions that we ask is, have you ever had a head trauma? And most people are like, "Nah, no, not really." But then I started looking at as as a kid, I was hit by a car on my bike. I was in a car accident as a teenager. We don't connect that to our current state of health in our
Yeah.
40s and 50s. But the reality is we now see that there's longevity in influence of our
Mhm.
health. So that I think is when we think about epigenetics, it's yes, there are a lot of things that we are exposed to over life and we cannot control them. The environment is the environment. But when we know what the environment is, we are given the power to make choices on what we do moving forward.
Very good. So it helps you understand, like, okay, I'm going to actually test for mold because X, Y, and Z, or I'm going to test for, it helps you figure out what testing to do to uncover the root cause.
Absolutely. And you brought up the gut biome. Like one thing that we see a lot is people have terrible, seasonal allergies, sinus infections, chronic issues. We start doing some food allergy testing and they've seen specialists all over. And I'm like, well, let's do a food allergy test. Let's do a mycotoxin test. Let's do a candida test. Let's check your gut. Let's see if you've got leaky gut, what's happening.
Mhm.
And the number of times we come up with, that nutrition plan that you're on to be healthy, your food allergy test shows that you're allergic to like 80% of that. So your
Mhm.
sinus issues we can tie to your food. And when we change that, you're going to find that you feel better. Or you have candida overgrowth in your gut. You have SIFO instead of SIBO, which is having a moment right now. And if we address the fungal overgrowth, you're going to find that you tolerate foods differently. You feel better. Your skin may clear up. Like there's so many subtle things that we in traditional medicine don't know about. We're
Yeah.
not taught. So
Mhm.
literally going back into functional medicine has been the learning curve for me after 20 years of practicing, health and wellness as a nurse practitioner. The stuff I didn't know because we're not taught blew me away. So I
Mhm.
can't expect the general public to know because nobody's being taught. It's not talked
Right.
about. We bring it to the forefront, and I love that.
Yeah, I love it. Yeah, I've heard you say before that it was almost like getting a brand new medical education when you swapped over
100%.
because there's a different approach. There's like a lot more thought, a lot more consideration, a lot more open-mindedness
Mhm.
about every symptom.
Yeah. Yeah, and
Yeah.
it's that's not to say that it's not science-based, it's very science-backed. I mean, I jokingly say to people, I did the Krebs cycle back in my chemistry
Yeah.
days, like, how many of you remember those? It is now when I run lab tests, it's literally highlighted in my lab results, like, I have to connect the dots from how every cascade it literally was so scientifically heavy in my learning, it was overwhelming, but
Yeah.
again, as a perpetual learner, it was so fun, and I've enjoyed this journey so much.
Yeah, it's awesome. I can tell, we've spent a lot of time together in person and crossed paths in a lot of ways, and it's very obvious that you're living and working in your passion exactly where you're supposed to be, and that's really inspiring. So I appreciate
Thank
you
you, I hope
sharing all
so.
of that with us. Yeah. We had a question come in on the live chat. Hi, Raina. Hi,
Hi,
Vanessa.
Raina.
I can only see two of you here, but it tells me there's more. How much does our DNA influence our gut health?
Oh, not as much as you'd think. So that's the short and quick answer, not as much as you think. A lot of our gut health, unless you were born with some type of congenital problem, a
Mhm.
lot of our gut health, because our gut turns over, it's not the gut you had at 5 is not the same gut you have at 25, 35, or 45. Our gut lining turns over time, but that's influenced by what we're putting in our body and what we're putting on our body.
Mhm.
Um, so it's not does that mean that if I have celiac disease, like true celiac disease, that I'm stuck with forever feeling crappy with celiac dis No, it means that we have things that we can do to change the impact that some of that has, but it's not so much our gut is one of the few things that really is not about so tied to our DNA.
Mhm. Good, I mean, that's wonderful. Um, I hadn't planned on asking you this, but it's on something I just listened to. Is it called Akkermansia? Akkermansia?
Akkermansia, akkermansia.
Akkermansia? That's that probiotic, right? It's a specific strain or a
Yes.
specific,
It's
bug or
a
whatever?
specific species that grows in our gut naturally, yep.
Okay, do you believe that we are deficient in it? It's kind of being, touted as like a miracle, um to fix our guts. Like, if we could supplement with this strain, we could fix our guts. What are your thoughts on it?
I
If you
definitely
have
think
any.
it's powerful. It's a powerful bacteria that's a good bacteria to have in your gut because it feeds off of a lot of the bad stuff. So,
Mhm.
I mean, am I a fan of it and do I recommend it for some people? Absolutely. Have I taken it myself? 1,000%. When we do a leaky gut reset, a lot of times, if we know what bug is deficient or overgrown, we can change your nutrition or sometimes supplement your way around to correct those deficiencies or overgrowth. So yeah, I think Akkermansia is a great product. It also, and there's some research to back that it helps with satiety, so that if you have
Mhm.
enough
Yeah.
Akkermansia, it can actually help with some weight regulation because it makes you feel fuller and it helps you absorb the good nutrient and ditch the bad. So it's having a moment. It's one of those weird science words that people are hearing now. So I love that you brought that up. But yeah, I'm actually in the Acromantia is a great thing to be familiar with and to try to chase.
Yeah. Do you have a brand you'd recommend?
I am a big fan of Metagenics and Designs for Health. Um,
Cool. We
I,
can link
I
those in the show notes.
yeah, I'm a Metagenics fan. And actually, if you go to my website, and this is not a plug, if you will, but just for people who are curious, if you go to my website, there's a link directly to Fullscript, which is a dispensary that carries, all types of supplements and products, including skincare products. And then there's also Designs for Health, which is the one thing that I will say for people who are going to use supplements is please make sure you're getting quality. What you're getting at GNC is not necessarily vetted. What you're buying off the shelves in Walmart and Hannaford and Price Chopper are not necessarily top quality product. And if you're going to spend the money, get a product that's been third party tested that you know has what it says is in it. Because there's been studies where we pull these supplements from any given shelf, test its contents, and what says it has, I'll say some 500 milligrams of vitamin C has less than 5. Like, because it's not regulated by the FDA, which is what a lot of people will talk about, making it, woo woo magic, not real science stuff.
Yeah.
It's not necessarily the case. Some of these companies really vet and check their product. The other one that I do really like is Standard Process. Standard Process, not only do they third party test, but they have built an entire farm area where they grow the products that they make into supplements. So they are regulating the quality from soil, water from the get go. So I do love Standard Process, but I will
Oh,
say they're a little bit more expensive. So some
of
people are a
course.
little averse to that. But there's some
Yeah.
really good products out there. So check what you're taking. And the other thing I'm
Yeah.
going to say, you didn't ask Emily, but I'm putting this, if it's coming in a gummy, it's probably not top quality because those are filled with fillers and sugar. And if you take that gummy stuff that you're eating, that gums up in your gut and it's hard for it to digest. So I know right now gummies are having a great moment. Everything comes in a gummy today. I'm not a fan. So I'm just
Mhm.
going to put that out there.
Well, and also what I've read and what I've seen in, like, when people take it, I love when people do this, like, there's a woman on Instagram, I don't even think I follow her. I didn't use Instagram for years and, like, got a new one, whatever, but she would take kids' water bottles and adults' water bottles and test them for lead, and she developed her completely own and then test for random plastics and stuff, but I love when people take it and consumers just test it, and they have, like, a verified ability to do that, but I've heard that the gummies are basically just sprayed. It's a gummy, and then it's just sprayed with, like, creatine or whatever supplement it is
Yeah.
supposed to be giving you, and so it's, like, a very inaccurate and
Yep.
consistent dose. So, yeah, I agree with you about the gummies. I totally would not recommend
Yeah, I'm
those.
not a gummy fan.
Yeah, definitely. We
Just
have one more.
just one clinician's practice opinion.
Yeah, mine too. I mean, if I think if there's someone who there are some people whatever, there's always an outlier, but yeah, definitely not recommended. We have another question from Reina. I heard that probiotics don't work unless you take the prebiotic. This is a good one. You take this one, Karen.
Not necessarily true. So there's prebiotic, probiotic. There's like 3 or 4 different biotics that everybody's talking about today. You can actually, like, I'm a huge probiotic and prebiotic. I use it in my toothpaste. You can buy toothpaste that has it. You can buy foods that now have pre and probiotics. It's real because the one thing that nobody's talking about is that we have so much bacteria in our mouth. Uh, Cleaning with prebiotics helps set what's happening in the gut, right? Because it's one big long tube. Our mouth connects directly to our gut through one big tube. So you have to kind of take care of all of it. It's not just what capsule you swallow to put in your gut, it's what it passes through. So not totally true that you need a pre in order to make the pro effective. And again, it really depends on what strains are in each one. And there are thousands of strains. So everybody knows about lactobacillus or, there's a few that are really popular, but that is only one. And that is not the key one, believe it or not. It's the most common, but it's not the key one that we are usually trying to regulate or impact. So I call that a false kid,
Yeah. Well, and also our food is serves as prebiotics
a
for the
thousand
gut
percent.
bacteria. Like the vegetables, the fruits, the grains, like the plants you eat
Yeah.
are those are going to function as prebiotics too. So unless you're on, an IV, like IV nutrition or TPN or something, like you're probably giving your gut something good to eat. And the better quality food you give it to eat, aka the plants, the more effective a lot of those strains can be as a broad strokes.
Yeah. I mean, barring processed, yes. Barring processed foods. And if you're getting, right now the other thing that's got a spotlight on it is fermented foods because they are really great for gut health for pre and probiotic stuff. So yeah, if you're eating the right things, like I'm a huge there's cottage cheese out there, which is also having a moment, right, for protein.
Yes, cottage cheese,
Um,
yeah.
there's pre and probiotic cottage cheese that you can use, which is like another layer into what we're feeding our bodies. So Raina's asking, what toothpaste do I use? I use Designs for Health. They have toothpaste with pre and probiotic. The prebiotic, I think Tom's also has a prebiotic. I used to love Tom's. The more I learn, I'm a little less. So again, I go back to Designs for Health because I know it's third party tested. I know it's regulated. I know it's clean. And it comes in weird flavors like lemon. Who would have thought of
That is a
toothpaste and
weird
lemon?
flavor.
Right?
Yeah.
But I didn't think I would love it, but I do. And they also have some charcoal in it, which is also very helpful for extracting toxins. So,
Yeah. Cool. That's a good idea. Yeah. Oral microbiome, depending on like how in the weeds you are, like for us, our algorithms are giving us this stuff. So this is really
right.
having a moment for us. Yeah, that's a big one. That is a really big one.
Yeah.
We should we got one more. Raina wishes she could eat cottage cheese. We could send you some recipes. There's ways
Yeah.
to make it into like a cream sauce or I
Yeah.
just made cottage cheese bagels this week. So there's ways.
I use
But
it in my
also,
eggs. Yeah, I put it scrambled eggs, egg salad. I use cottage cheese to boost the protein and the probiotic. Yeah. There's ways to make it so you don't taste it that
yeah.
makes it much more palatable.
And you can change the texture too. People have issues with the texture. I don't really because I'm not a texture person, but I've heard that a lot.
Yep.
Yeah. Well, let's talk about hormones. So
Okay.
when
Hormones.
we were like, let's do this chat together, what do you want to talk about? You were feeling like PCOS needed a little bit of a spotlight. So talk to me about why PCOS is on your radar right now. Is there emerging research? Are you happening to see it a lot in your practice? What's going on with PCOS these days?
So yes, we see it a lot. That is one reason why I think it's important. The other thing that I wanted to point out is right now, menopause is also very big on the radar, right? But
Mhm.
so I think PCOS has been dismissed, and PCOS is kind of thought of as it's a fertility issue. It's a young girl, fertility issue, but it's so much more than that.
Mhm.
PCOS is literally, I mean, the symptoms. Let's just talk quickly. What are the symptoms of PCOS that most people are familiar with? Um, Overweight, excessive acne, facial hair, sweating, mood swings, emotions. These are all things which, by the way, are not far different from menopause. It's just we see it, it's typically described as or diagnosed in younger years. But here's the thing that I think more people need to understand about PCOS. It is directly tied, those hormones are directly tied to our metabolic signaling as well. So when you have PCOS, you are more likely to have, let's go with insulin resistance,
Mhm.
inflammation, stress physiology issues, gut health, which we've talked about, hormones tied to gut health. And the thing with PCOS that we don't talk about right now, testosterone for women for menopause is having a big discussion.
Mhm.
Um, PCOS is also tied to testosterone, which is an androgen, which is it's a male hormone that we as women make and produce and absolutely need.
Mhm.
So in our younger years, when we have too much testosterone, that tends to be also a component for PCOS. And I don't think people connect those dots that PCOS is a earlier signal of metabolic complications that we should be picking up on. It's a signal or a symptom of future issues, and we need to be more aware of it. We need to talk about it more. I joked just the other day because is anybody else noticing on TV these commercials? I'm watching really graphic commercials about women's pubic hair and the razors you're supposed to use, or tampons and the string and the size. And there's like all of these commercials that, let's be honest, when I was growing up, you didn't even mention those things. They were not talked
Right.
about. So I
Right.
love that we're talking about them, but I feel like we're talking about the superficial things and we have bigger things that we should be addressing. And if we're going to talk about women's physiology, particularly in our younger years, then let's talk about how it's a signal of things that could be going awry. Not here's your razor to shave off that extra hair you're growing. Like, do you know what I mean?
Yeah, yeah.
It just it's
Those have, like, shaped whenever someone wants to market something and gets enough money behind it and gets enough momentum, it completely shapes the cultural norm. That's,
yeah,
like, the dairy industry and the Got Milk campaign is why I had to finish my milk at dinner every night. It's like
yeah,
and then in one generation, like, my kids have never drank cow's milk as, like, a regular necessary beverage. One generation. It just
yeah.
completely flips. It's all marketing. Yeah, so, like, there's a war on pubic hair because the razor companies wanted to make money. It's
Yeah, well,
probably
and
more intense than that. There's a lot more to that, but,
yeah, there is,
it
and
is
I'll
what it
be
is.
honest, part of me is like, "Why are we seeing all these women's in skimpy clothes and bikinis being talked about by m" but then you go and watch a commercial about finance, and it's men fully dressed, but they're floating in a pool, like, how come we're exposing ours like, it's still
Yeah.
that he versus she,
Yeah.
stigmatism that we battle. But yeah, I think it's important that we recognize that PCOS is an early signal to what's happening with our bodies that could potentially lend us problems in the future, and including even things like bone health. Those hormones that we're talking about impact our bone health. So as we continue to grow and I don't want to say age, but mature, um, it's a signal that we may be having problems in the future, so I think we need to listen to it, and I think it's underdiagnosed. I think if I had
Yeah.
known what I know now 40 years ago when I was a teenager, I would have been diagnosed with PCOS, but it wasn't something we talked about.
Mhm.
So I just wanna bring that forward and "Hey, ladies, it's a signal, it's not a failure." If you're struggling with
Yeah.
your weight, and your hormones are awry, that's not something you are doing. It's a signal.
Yeah.
Let's talk about it. So
Yeah, and it's more a metabolic disorder. It's more akin to
100%.
type 2 diabetes, or it's more akin to, like, the metabolic trifecta than it
Yes.
is to a fertility issue or a menopause issue or whatever. Like, it just I've read some things that, like, people are really trying to get the naming convention changed
Mhm,
because it's like a hormonal soup issue that affects men as well.
mhm.
Like, it's
Yep,
not just tied to your ovarian cysts. That's actually
correct.
not what it is, it's had the wrong name. It needs a marketing campaign
It
to be
does.
fixed. It needs a brand, and maybe it's called a branding campaign. It needs a new branding campaign so that people can get the right information,
Yep.
and treat it. And can you tell me if these 2 things are true for anyone thinking, like, are these are the 2 common, like, differentiators that I was taught and I've seen firsthand in people with PCOS, women with PCOS, is that their weight distribution is centered around their midsection instead of traditionally women, with, like, the typical hormonal profile will carry it more legs, butt, hips,
Mhm.
and then stomach, whereas, like, PCOS presents with, like, thinner legs and then all midsection first, and then
I
the
think
other one. Go ahead.
just to
Is that
I'm
true?
gonna touch on that one is there's truth to that, but I would caution that that is not a definitive like, if you
Right,
have well-distributed fat, you can't have PCOS.
right, right,
So, yeah.
right. And then the other thing for someone to think about, like, this could be a metabolic issue, not just a weight issue or whatever, is the darkening of the skin. That was the other one that I was taught. Those 2 things could differentiate PCOS from other stuff. What do you think? Is that
Uh,
it's possible?
it's a possibility, it's definitely a symptom of PCOS, but again, I don't use it as if you have, dark spots on your skin, you have PCOS.
Right,
It's not a one
right.
or all, but is it a symptom that we tend to see? Yes.
Mhm.
Yes.
It can just help people ask better questions like, "Hey, I have these 2 symptoms. I want you to test for this." Because not everyone gets the pleasure of landing in your office with someone who's actually gonna do it. And what I see a lot is people having to be like, "No, I want you to test me for PCOS. You've never had cysts on your ovaries. No, that's not what it means. I have this, and I have this. Please test me for this."
Yeah,
People have
or
to do that to get proper
yeah,
testing from
we've
even from their OBGYNs.
yeah, and a lot of OBGYNs, particularly in younger women, don't test hormones because and
Yeah,
there is some logic behind that because again, the blood test that we use to test hormones is if you think of it as an old-fashioned Polaroid, that's all it is. It's a snapshot in a moment of time, and our hormones shift so frequently, particularly when you're going through that, puberty into, the premenopause phase. So I think or the perimenopause, I think it's important that we recognize that all tests are not created equal and it's not, but it's a start. We need to be asking the questions and yes, testing. I think the beauty of functional medicine is we test, we do more of a urine test to look at hormone fluctuation because that tells us really not just what's running through your system, but what's being used and released for absorptive rate. And it gives us a longer picture because we tend to do it over a full day. So we do like 4 different samples of urine throughout a day so we can see what your hormones look
amazing.
like first thing in the morning. later in the morning, later in the afternoon. Let's see what it looks like at night. And there is a, if you think of a bell curve, there is a curve of hormone flux that we should see. So doing that one snapshot, you also have to know where they are in their menstrual cycle. What
Yeah.
phase are they in? Because that's going to change your hormone levels. So it's really nuanced. There's so much to it. And I don't expect people, the general public to understand all of that. But we as clinicians need to do a better job explaining a lot of this to our patients.
Yeah, so that just answered my next question. I wanna talk about what can providers be doing better and what can patients be doing to best advocate for themselves in the conventional setting. So what one of the things providers can be doing better is asking better questions and considering urine testing,
Yeah.
if you
Well,
wanted to
it's
say even one thing.
yeah, and sometimes I will say insurance doesn't pay for those tests. A lot of
Yeah.
times it's what will my insurance cover? Those are the tests I'll do. But until we normalize testing those things, insurance is never going to pay for it. So it's kind
Mhm.
of a catch 22. And here's the other thing I'll tell you is a lot of these tests are not as expensive as you might think. I was blown away as someone who has ordered labs for 25 years on people when I started ordering tests through these functional medicine platforms to find out that a CBC is like $10. Suddenly that becomes so less impressive when I'm ordering it every day on people, when they're acutely like it just again, it's an insurance driven thing. The costs are so it
So
that's a whole nother dialogue that we can have. But
yeah.
yeah. So being open to asking questions, I think the things that we as clinicians can do better is ask more information, actually listen, be present and not be watching the timer. Uh, and to think outside the box. We've been taught our education system in healthcare is very much driven by what it's an indoctrination to thinking of here's what we know, here's what we do, here's how it's treated, because here's how it's treated is what generates revenue. The
Mhm.
diagnostic code is what gets, you know, reimbursed.
Yeah.
We're very language driven, but we don't realize how much we don't know. So continue to learn as a clinician. Be open to learning new things.
Yeah. Beautiful. Well said. What can the everyday person do who's seeing their traditional conventional doctors and going through the insurance system because that's what's accessible for most of us, like
Right.
what can we be doing to better advocate for ourselves and ask better questions and get better outcomes and better care?
I think one of the first things I would say is come prepared. When you know the current system said you've got 15 minutes, come with a list. Sit down
Yeah,
before your appointment. These are the things I want to touch on. And the other thing that I think it's important to tell your clinician is this is how it's impacting my life.
brilliant.
Like they need to see that these symptoms have an impact. I'm not whining, I'm not complaining. This is impacting my life. And then if you don't get the answers on the first go around, do it again. And if you don't get it still, go to somebody else. Talk to everyone about it. The more you bring it up, the more you point it out. You're not crazy. You're listening to your body and the signal that's giving you. We need to listen to you. That's what I would tell people to do. Come prepared. And the other thing I will say is use your words. When somebody says, well, I just don't feel good. As a clinician, you'll see an eye roll because like, I don't know what that means.
Yeah.
Be able to put it to words. I have this sharp stabbing pain in the right side of my head every morning when I wake up. Like that is much more than I have a headache. You
Mhm.
see what I'm saying? So
Mhm.
use your descriptive words because we can better pinpoint what's happening or it gives us better information on where to be looking. If you can tell us, if you can't tell me what your symptoms are because it's vague, it's very hard for us. It's hard for us to make a diagnosis or create a plan. We end up throwing out this huge net to try to catch everything. And then people get frustrated because we're just doing everything.
Yeah, that's such a good tip is be as descriptive and like because every clinician is like, I'm tired, I'm brain fog, I'm low energy, my tummy hurts, I get headaches. Not it's not gonna get through their filter. They're gonna glaze over all that. But if you
Yep.
say, I have a headache so bad I can't take care of my kids, I've missed 15 days of work this year. They're, oh, okay. I can tie that to something and they might be more responsive.
Yeah,
That's
and
a
it's more
really
of,
good,
"Oh, we need to really investigate this because
yeah.
this is not a way to live."
Yeah. So if you put vague out, you're gonna get vague back. If you're more
Yeah.
specific, you're much more likely to have success. That's a really brilliant tip.
Yep, that's
I
my
have
tip.
one I have one that you tell me if you think this works. I help my clients prep for their doctor's appointments, their specialist visits, everything, going into talking about their GLP-1 dosing, all that stuff. And one of the things I tell them is set the stage when it's time to ask questions. Doc, I have questions for you and I need answers before I leave.
Mhm.
Doc, I need this from you today. Like set the stage. Do you think that helps?
Absolutely.
Okay. Good.
Yeah, I think it's all too often that people come in for an appointment, and it's the clinician comes in, "Hi, how you doing? How are things going?" We have very,
Mhm.
standard, "How are you doing? How are things going? How have you been feeling since I saw you last?" Um, okay, and if you don't, "Here's what's happening, doc. Here's what's going on, Karen." We're gonna just keep glossing over it. I'm gonna assume everything is fine. You've got nothing really to issue. So if you set the stage instead of letting us walk in, set the timer, and even if I'm that clinician who's setting the timer, quite honestly, it should be clocks on, go. What do I need to know? You
Yeah.
should be telling me if I'm clocking, you tell me what I need to know. You got 15 minutes. Send me the messages I need to hear so that I can address your signals that you're already aware of.
Mhm.
So,
Yeah.
yeah, I'm a fan of anybody who can guide them. And actually, you and I are going to need to talk on a different conversation about doing exactly that. So,
Yeah. Yeah.
love
Awesome.
that.
Good, good. Um, I wanna ask another thing about PCOS. So, I do a lot of work with people taking GLP-1s, and it's a metabolic disorder, and, there's off-label, there's on-label, there's all kinds of stuff. GLP-1s is its own 3-hour conversation, uh, 3-day conversation. So, what are you seeing? Do you have patients with PCOS on GLP-1s? What are you
I
seeing in
do.
the research? What are you seeing firsthand?
I have people on GLP-1s. I do prescribe them. I do think they are a powerful tool. Um, but that's all I use it. They are a tool in a huge chest. We have a war chest of things we can
Yeah.
tackle with tools to use. This is just one. I think they're overutilized. If I'm gonna be honest, I think nobody's talking about the hormonal impact that they have, both short term and long term.
Mhm.
Um, I think if you tie into these GLP-1s are predominantly being used. I mean, the arch is weight loss, but the reality is it's metabolic syndrome.
Yeah.
And so if you tie it to those things and we connect the dots, I think it's much more valuable for people to see them as this is this is one component of many. Like, even talking about the nutrition for these people on GLP-1. So if we talk about you need to eat more protein, you need to do more weightlifting, there's got to be behavior change. The number of people on GLP-1s who are still having cake for breakfast and drinking a bottle of wine at night, and they're still eating all the foods that deliver zero nutritional value. So the muscle
Mhm.
loss is huge, and you're still filling your body full of sugars and carbs and all the things that don't build resilience for your metabolic system. And those things, let's be honest, sugar and carbs impact not only our gut health, but they impact our estrogen, our progesterone, our estradiol, our thyroid. Like, what we feed our body triggers an entire cascade that is all interconnected. So nobody's talking about that. We're talking about the weight loss component. So I love that you're guiding people on that.
Yeah. Yeah, it's tough because like, I really people one of the biggest things I help people with is their gut health, but gut health is downstream often from the medication and the side effects and the fact that they don't have an appetite.
Mhm.
And so, I practice in that every bite you eat needs to be doing you a favor. You don't have margin.
Right.
And it's so
Yeah.
complicated, but it's like it's tough, and I'm someone who I wanna talk about breakfast. I have never taken a GLP-1, and I don't have any medical issues that should cause me appetite challenges, but I've just never been good at eating breakfast. I'm cyclical. And as a dietitian, I've always known that's important, and now there's research and common information coming out that like it's actually even more important for women because it gets our bodies out of fight or flight in the morning hormonally, helps our cortisol dip. Like that's been a big conversation. So I'm taking it even more seriously than I used
Mhm.
to, if we, yeah, GLP-1s maybe we'll get back to, but tell me as a hormone educated, driven, empowered practitioner, what should we be eating for breakfast as women who want to set our day up for success hormonally and holistically?
Okay. So, 1, protein first.
Mhm,
2, water.
mhm,
So, hydrate and protein first. So, quick and please recognize this is not medical advice for everybody, but this is kind of a rule of thumb. Uh, a lot of women are like you and they don't like to eat in the morning. So they don't start their meals until like 11, 12 o'clock in the day. And they've been up since 6. Or, they've got the kids on the bus. They've gone to work. They maybe had their coffee in the car. We start with caffeine. Um, I do, and I practice these myself. No caffeine for 45 minutes to an hour and a half from waking. Caffeine keeps us in that fight or flight zone. It also keeps us tired. So there's other hormones that rise and fall with our cortisol. Um, and they keep us in that fog. So if you're someone who starts your day with coffee first, a lot of times people are reaching for their next cup of coffee by 1, 2 o'clock in the afternoon because they're hitting a wall because you've maintained neurotransmitters that keep us sleepy. So if you can avoid it, get up in the morning, move your body, 5 minutes counts. I also so I'll tell you what my routine is. I wake up in the morning. I have lemon water with ginger and turmeric, fresh root, to start my day to kind of kickstart my gut. I do 10 minutes of stretching or exercise. Because I have a dog, I go outside for 5 to 10 minutes, regardless of the weather, fresh air. And
mhm,
yes, we're in the Northeast, but a little bit of fresh air and sunlight. Um,
mhm,
also stimulate that wake up, rise, get out of fight or flight mode. So, and then I come in, I'll start prepping for my day. I have 20 ounces of water, usually with an oral peptide that I tend to take to get myself hydrated a little extra at a metabolic cellular level. I start with protein first, a healthy fat, maybe like so yesterday my breakfast was um, yogurt, cinnamon, blueberries, raspberries, and a little bit of protein powder. For people like you, Emily, who are not morning eaters, I hear you. I was you. You can, when you get to that morning coffee drink, creatine, collagen, they're not complete proteins. A collagen is not a complete protein, but it has most of them run 10 to 15 grams of protein. That's a start. That blunts that cortisol, that blunts the
mhm.
glycemic. If you're someone who's putting sugar and cream in your coffee or flavored whatever, it blunts that sugar bust. So I think finding hacks to get in. I also tell women if you're someone who gets up and starts on the go and you're going to the gym, fasting is not ideal for women.
Yep.
So you shouldn't be working out. Fasting more than 12 hours, I don't recommend for most women. 8 to 12 hours is fine, but if you're fasting for 16 hours before you start your meal for the day, you're already in depletion mode. Like you're behind the 8 ball. So you're kind of counterbalancing what you're trying to do.
Mhm, mhm.
That's so protein first, hydration, movement, and it really doesn't have to take it's not a 2 hours, so like I don't have time. I literally roll out of bed onto the floor and start my stretches before I even do it, or I start them in my bed.
Oh, mhm.
I get up and I drink water, and then I like as I'm starting my things, and then coffee comes. That's like my reward. I can now have my coffee with my collagen and creatine in it, um, and then that kickstarts my day. That's what I recommend for most women, whether you're in your 20s, 30s, 60s, 70s. Hydration
Yeah.
and protein first. Hydration, protein, movement first thing in the morning to set the tone for your whole day. If you're someone who likes to journal, journal. If you meditate, meditate. Throw that in.
Yeah, yeah. I think it's so I mean, I force myself to eat, but it's a game. Like, it's a fun little game I have for myself because I love food and I like cooking and I realize the importance, and so I gamify it and try to lighten it up a little bit. Like, I know I have to eat, but my appetite is low in the morning. Even if I stopped eating, we eat dinner early, right? I stop eating at 6 o'clock at night and I'm up at between 5 and 7, depends on the day.
Sure.
But, and I'm not hungry, but I am forcing myself and I am figuring it out. And I think that's just, it's, if you're struggling with it, just try to lighten it up. Just try to
Yeah.
a few bites of something and then come back to it. Even if like my body doesn't want to eat breakfast till like 9:30, but I get up way too early for that. So I can't be doing that. So just
Right.
just have a few bites, put it away, come back to it, whatever, like just find a way. And I take my coffee the same way. And I used to do it first thing. And then I realized I was keeping myself, I was actually sending a cortisol spike, even though I was putting collagen and a little bit of milk in it. I was like, "No," and so now I'm doing it after breakfast too, so that also helps me as a reward. Eat the breakfast,
Yeah.
then you can have your coffee.
Yep, and that's what you can even put a protein. I mean, for people who are on the go and they don't like a full meal, put some protein powder in your coffee or,
Yeah, grab
make
a
it
protein
light.
drink, grab a banana, and then,
A
figure
hard-boiled
out something
egg.
else. Yeah.
Yeah,
Yep.
something it doesn't have to be a full meal if you're not a
Mhm.
morning eater, but
Yeah.
just something that is protein forward.
Yeah.
That's my recommendation. And
Mhm.
hydrate, 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 hydrate.
Yeah, very good. Do you do the lemon and the ginger and the turmeric you said to wake up your gut?
To wake up my gut, and it also because I found that, like, I was doing overnight oats and stuff. I have a body composition where eating something cold first thing in the morning actually works against me. I need to start my day with something warm and soothing,
Mm.
and that helps me slow down a little bit so I'm not starting on the run. And it's just yeah, it just wakes me up a little bit. It's a great gut cleanser. And it gives me those supplements that, the
Yeah.
adaptogens of turmeric and ginger that are so good for our gut. So, yeah.
Mhm. Yeah, that's a really good idea. I'll let you go in a few minutes, so we'll wrap up. But I want to know, anything else about hormones? Like maybe the most meaningful thing you can answer directly would be like HRT is very big in menopause care, and there's a lot of different varietals, and it must be individualized. I say to people who ask me, I am not a prescriber, that is above my pay grade, but what I can tell you is the clinician needs to be asking you X number of questions. You need to go in with this kind of preparation, and it needs to be individualized to you, and they have to be willing to answer your question. So, what do you want us? What would you like everybody to kind of know about HRT for both women and men
Okay.
within a few minutes? I know this could get its own hour as well, but what are some things
Yeah.
people should know or where to start?
Well, I love that you're highlighting the fact that it is very individualized. Um, Hormone therapy is absolutely very nuanced and personalized. It's not for everybody. I know right now they're saying everybody
Right.
could. It's not for everybody. And I think it's important to, again, if you understand the hormone cascade, there are some women who are very estrogen dominant, some who are more progesterone dominant. And you have to know who those people are because that's gonna drive you. So if you have somebody who you walk in and you say, "I'm postmenopausal, I'm having hot flashes, and I have vaginal dryness, and I'm irritable," a lot of prescribers say, "Okay, here's your estrogen patch, here's your progesterone, to sleep at night for the hot flashes, and here's your estradiol cream for your vaginal dryness." Those are great tools. Not everybody needs all of them. And the dosing matters. So I do
Yeah.
think it's important that you have a good conversation about what are your symptoms, where you are in your stage of life. Because we have women who are perimenopause who are starting hormone replacement therapy. They're using hormone replacement therapy for bone growth, for bone density support. So
Mhm.
it's really personalized. And it's not protocol driven. It's not everybody's on the same thing. But what I'm finding is most women all seem to start on the same regimen. Like, it's pretty
Mm.
so I do worry about that. Testosterone and men for hormones. A lot of men are testosterone supplementing. Again, stage of life, symptomatology matters. Other comorbidities, what other health complications do we have? They have to be
Mhm.
considered. Risk benefit with all of these. These are, while they're natural hormones, because we all make them, yes, we women make testosterone too, men make estrogen. Um, we all have different level of needs. So being very clear again in knowing what your symptoms are, being able to, I mean, I say this phrase all the time, please use your words. Like you would with a child who's having a tantrum, but it's like I can't go with a very vague. So be clear in what's happening with your body. Listen to your body and then tell me. And we'll create a plan from there. And it may not be perfect. We may need to adjust dosing as we move forward. So be prepared. That's why you have to know your body first, because if if I put you on a hormone and you come back in 3 to 6 months and I say, well, what's different? And you're like, I don't know, I feel about the same. Then you're not really listening because something should have shifted a little. I have more headaches. I notice my hair's falling out. I have a rash. I have some women who will start getting their period again who are postmenopausal when we go on hormone therapy. Th- Like you have to pay attention. That's why I think
Mhm.
functional medicine, I'm going to go back to, we're a partnership with our patients. It's not, I'll tell you what to take. It's
Right.
you tell me what's happening and we'll decide together what maybe you only want to start with. Maybe vaginal dryness isn't your issue. You don't need estradiol. You just need progesterone to help you sleep at night because you're, wired but tired all the time because you're not getting good sleep. And then use the tools. Let's use a tracker that checks your sleep. Let's check your HRV. Let's check how many steps in the day. What's your diet look like? If your clinicians aren't asking you about your diet,
Yeah.
they're not seeing the whole picture.
Yes.
And what foods could I be eating, Karen, that might help boost my hormone if I'm estrogen dominant or if I'm struggling with postpartum depression or,
Mhm.
our hormones are so complex and so nuanced at every stage of life, but they are a constant in every stage of life. Like they're not, we suddenly got hormone problems in menopause.
Mhm. Yeah.
So being aware, they are one more component of a system. And we've talked about it's a metabolic component, like everything's tied. So
Yeah.
that's my
Yeah.
take on hormone therapy.
Okay, very good. So ask questions and find someone. Like, how do you have any recommendations for someone like, how do I find a provider that knows this stuff? Is it the obvious answer, like just start asking questions, start asking around, almost interview the provider? Like, hey, do you
Yeah.
specialize in this?
There are some who specialize in this. And again, because so many people rely on their insurance, you're
Yeah.
going to stay within the traditional medicine realm, which is fine, but ask questions
Yes.
and be your best advocate. Do a little bit of research. And if you're not getting the answers you're looking for, then find somebody else. Or if it doesn't feel right, if it's, the clock ticks and time's up, I got to go. We didn't answer any of my questions. That may not be the best fit for you.
Mhm.
And
Yeah.
that's okay. That's totally okay.
Mhm. Yeah, and people have this, like, hesitance to, like, go all in on their health, go all in on and I feel like my response is always like, "Well, then what else is there?" Like, if you're holding back from caring and putting full effort into your health and putting full effort into advocating for yourself, what are you using it for?
Right. Well, and if that's a great indicator to me of whether or not you're seeing the right practitioners. If you don't feel
Yes.
comfortable asking questions or speaking up or, then that's not a good fit. Whoever you're
Yeah.
seeing, you should be able to walk in and be able to sit down and have a real dialogue about your health because that's what you are there for. That's
Mhm.
if you don't have health, and I know it's a cliche statement, but if you don't have your health, everything else pales in comparison to what's important.
Yeah.
So you are your best advocate. This is the only body we get our
Yep.
entire life. So this is a sacred vessel.
Yes, and you're the only
Ta
one who has to live in it. You're the one who should be calling the shots.
Yes. Yes, and
Mhm.
if you don't know, ask, and if you don't get the right answer, ask again or ask someone else. I'm okay with that.
Good. I love that. Yeah, I love a provider who's like, "Yeah, please go get a second opinion. You should. You have to live in your body."
Yeah, and
Yep.
I will say that's the one thing that I see as someone who's outside of standard medicine. When patients come to me, it's usually because they've tried all of these things and they're not getting heard or they're not getting
Yeah.
answers. And what we see now, even more so, is when patients go back and tell their providers, "Hey, I saw this functional medicine practitioner and this is what they're recommending." Those providers a lot of times are like, "Great, I'd love to see what they come up with. What secrets can they uncover that I haven't been able to support you in?"
Yeah.
A good clinician is open to that. And
Mhm.
I've had other clinicians be like, "Can I send this patient to you? I've tried everything, I can't figure it out. Can you take a look?" Absolutely. We are just, again, another cog in the wheel of health for
Mhm.
everybody. We all have a role to play. We all are a support. So, for sure.
Yeah, absolutely. Okay, well, tell us, what do you wanna be doing when you're 80?
Exactly what I am doing, advocating, educating, and supporting, and
Yeah,
hopefully still working out and having cool talks with great people. That's what I
I
want to be
love
doing
it.
at 80.
I love it. Thank you, Karen. So tell us, we'll link everything in the show notes, of course, but tell us where we can find you and get in touch with you and learn more about your work and all the good things.
Sure. So Power of One Health is my company. If you go to powerofonehealth.com, I'm on Facebook, both under Karen Hall and Power of One Health. I'm on Instagram, Karen Hall. It's just if you type in my name because it's Karen with an I usually pop up. Um, and I'm all over town. Yeah, find me.
Awesome. And we'll link to your full script account too. Folks can just order that. They can just go there and order the things. Like if they want to get the toothpaste you talked about or things like that, they can order it right through there.
Yep, and I will tell people if you link up with me through that, I can offer discounts. So
Great.
if we're tied in, so if you're looking to save a few dollars.
Wonderful. Karen, thank you so much. And I will see you around. And thank you everybody for tuning in. And we'll see you all next time.
Thank you, Emily.
Thank you.
Bye, everyone.
Bye.